I'm Tony Scott with bnetTV. We are here at the mHealth Summit for 2012 in Washington, D.C. I am speaking with Mr. Joseph Kvedar of the Harvard Medical School and the Center for Connected Health. How are you today, sir?
I'm well, Tony.
I had to read that off the card. That was a mouthful for me. But as I said prior to getting on camera, I was a little vernacularly challenged today. However, I love this conference so much because it's technology meets health, and it's changing the way lives are being lived, and it's going to change the vitality of the globe, which is incredible.
It sure is.
So let's talk about connected health.
Well, I think that the first thing to say is what's the value of mobile? This conference has been growing, and it's about mobile, and really the value is that just-in-time, always connected piece, because that really does change the way. It's a game changer in healthcare delivery. The fact that I can find you and message you in the moment when you need it most, and I can also collect everything about you as you wander about this earth through your mobile phone. That really enables us to do things in healthcare that we've never been able to do before. The Center for Connected Health is a group of about 50 professionals now at Partners Healthcare in Boston, our largest delivery system in the New England area, one of the largest in the country. And we're committed to a healthcare delivery model that brings care out of the office, out of the hospital, and makes it a continuous function in the lives of patients. And we do that through mobile technology and through designing programs that are sticky motivationally and take advantage of objective data feedback loops like pedometer data or blood pressure or what have you to keep people healthy in their homes. And we're having great success with it.
Who is the leader? Who's the guy driving the bus behind that particular initiative? I mean, the Center for Connected Health clearly has its thought leaders. You said 50 people, but who's the leader of that, and how did it come together?
Well, so I founded the group 18 years ago.
Congratulations on that.
And it was because I'm a dermatologist by training, and I saw through some work we were doing in imaging and dermatology, I had an aha moment, and I saw the opportunity to improve quality of care, improve delivery, add value by separating doctor and patient in time and space, which was just so counterintuitive. And I had to say, wow, there's a lot we could do with this, let's try. And that was before the Netscape Navigator, so we've come a long way. But really, it's been a blast, and we're just hitting our stride because really a payment model reform.
Well, that's very fair. That is
really
very fair.
All of a sudden, the doctors in our system are coming back and saying, I could see this home delivery stuff, whereas I used to get kind of, they would pat me on their head. He's a nice little boy, he doesn't quite get it. And
that's fair, but technology has obviously progressed to a point where it is the data collection and the movement of data from the carriers is facilitated at a much more rapid pace. The technology exists to be able to collect it, move it, push it, and from what people I've spoken with, doctors that I have spoken with, they're all willing to embrace and adopt those policies.
Yeah, we're getting much better traction with physicians now. As I said, the three things you need for physician adoption of any new delivery are, number one, quality. So we've done a lot of research, and others, to show that this kind of care delivery can improve quality. It will not erode quality. So that's the first thing doctors want to. What's the evidence base? Show me the papers. So they're out there. The second is, how do we pay them for their work? And payment reform is taking care of that for us.
Okay.
And the third is, how do we work it into their workflow? And for instance, at our center, we've just had a really exciting milestone where we now can round trip data from any number of devices like a blood pressure cuff or a glucometer or a smart pedometer or weight scale in the home of a chronically ill patient all the way into our electronic record, so that when the doctor or nurse looks at that patient's record, they can get access to their home monitoring data.
What are some of the challenges that still exist within this portion of the sphere, and what is the Center for Connected Health doing to help get over those challenges?
Well, the data still isn't, I should say the technologies are never perfect. They're still always, we can always improve. We have a vision of what we call wear and forget. what we've discovered is patients, like anything.
Forget to wear.
No, anything that you ask them to do is too much.
Okay.
Right? Taking their blood pressure is a chore, but taking their blood pressure and then having to push a button to send it to us is a non-starter. It's really amazing. But so we set things up, and we can continually move to this wear and forget model. The second is that healthcare providers, and they are changing and it's getting better, but they still gravitate towards human resource rich solutions. 60% of our costs in healthcare is labor. We can't keep adding labor. We've got to rethink the way we deliver care. And so educating healthcare providers that certain things can be automated, it's okay. We don't have to employ 300 nurses. We can employ 150 nurses and spread them across more patients. Actually give patients things to do for themselves. Right? Make you your own doctor whenever possible. So that's the direction we're heading in with that problem. And it's slow going, but people are starting to listen because, again, the incentives are changing.
And finally, Joseph, why is it important to be involved with conferences like the mHealth Summit?
Well, two reasons, I guess. Everyone's here who in the industry, so you get to really just, it facilitates business development, decision making, because you can meet anyone you really need to meet. And you get every year a fresh perspective on where the industry is headed, which you can take back to your own implementation silo, whatever you do, and you come armed with that context, which is just invaluable.
Joseph, thank you so much for taking the opportunity to speak with us here today.
Great to talk to you.
I hope we get a chance for an update again in the future.
All right, take care.